How can sex, athleticism, and pregnancy postpartum all end up in the same conversation, you ask? Well, we do today when I have my guest, Dr. Juan Michelle Martin, come on the show and we talk about all things pelvic floor PT, sexual counseling, and her work as a pregnancy and postpartum doula. You don't want to miss this episode. She's a mom of 3 and talks about her experiences as well as how she works to make collaborative models of care available for her clients. Come join the show. All right. It's not that often that we have a triple threat. Actually, it's a quadruple threat on the Active Mom Postpartum show. Today, we are so lucky to have Dr. Juan Michelle Martin on, and she is not only a mom of 3 plus a bunch of pets. We'll get into that. She's also a pelvic floor physical therapist, a sexual counselor, and a doula. What does she not do? Thank you so much for coming on the show today. We're so happy to have you.
Thank you so much for having me. It's always a pleasure to see you. I talk about you all the time anyway, so
Oh, we've met a couple times in
a
person, I
couple
feel like.
times.
Yeah, it's
Mhm.
like been pre-COVID, and it's one of those things where you just turn around, you're like, "Ah!" Which I love, which I love. Tell everybody kind of quick down and dirty who you are, what's your deal,
Yeah, so
why
I'm
you're
Dr. Juan
amazing.
Michelle Martin. I go by Dr. J. I apologize for my voice right now, but like I was telling Dr. Carrie, I coach volleyball too, as if I don't do enough things. And so, when you coach teenagers, sometimes you end up sounding like this. I own a practice in Atlanta metro area, so in Duluth, Georgia, where I see doula clients. I see clients for pelvic floor physical therapy, whether they're pregnant, postpartum, for sexual dysfunction. And I'm also a sex counselor and wrap all that up in a nice integrative health coaching background, just so that I can give people as holistic an approach to care as humanly possible.
So literally all the things,
Oh,
like all the things. So talk to me about kind of the like, how do you get into doing all these things? Plus, our kids are similar age. Like,
mhm.
how did your kind of experience as a mom sort of mash up with what you were doing as a PT and then kind of culminate in this really big holistic approach?
So when I was pregnant with my daughter, I mean, I was relatively healthy, play sports all my life, play sports like at the collegiate national team level overseas kind of thing. So I've always been healthy, always been active. And it comes down to pregnancy, and I'm thinking, oh, well, this will be a breeze. And then felt like I was fighting with everybody in the delivery room because they're like, well, we need to give you this and we need to give you that. I'm like, but
Yeah.
I'm fine. Even to the point when I told the nurse, I was like, well, the baby's coming, so we should probably get the doctor. She's like, you're not ready. And I'm like, do you want to get her or do you want me to get her? And so the doctor comes in and she goes, oh, yeah, you're crowning. And like 2 minutes later, my daughter was out. And I'm looking at the nurse, next time, could you please listen to your people?
Oh my
And I
God.
recognized, like, I was back in the gym at 6 weeks later coaching, but I recognized that that wasn't the path for everyone, and I was like, well, I know what to do. How many other moms, don't? And I started tuning into the stories more. And what was interesting was I was already in the hospital floating to mother baby. And then I was like, well, why are these people not being seen? This person's high risk. This person is this person's that. Like, why are we
Right.
not? Why is there no consistency there? So I kind of started to make it my business to, start to be more visible there, be more vigilant and see what was going on. And then starting to recognize that it wasn't only the pregnancy and postpartum, but it was, the perimenopause, it was the sexual pain, it was the societal narratives that we just don't talk about these things because it's inappropriate. And I'm like, how is it inappropriate? You all got mothers. Like, why is it
Right.
inappropriate? So, so I kind of just was like, okay, that's going to be my quest. I'm going to go do that. I'm going to
Yeah.
go focus more on that. And I've loved it. I've loved being immersed in the world of pelvic health. I love learning. So that's kind of where the doula work comes in. Well, how can I better support my pregnant clients? The sex counseling, how can I better support these individuals who are coming to me with chronic pelvic pain and sexual issues? And then the fact that, I always tell people it's seldom the symptoms that they come in for that's truly the problem. And that's where the health coaching, I've absolutely loved the health coaching background because I've got people coming in, and I had one young lady come in this week, and she's talking to me about all the things. I'm like, so let's talk about your stress level. And she just
Yeah.
busted out in tears. She's like, I'm going through a divorce and this is happening and this is happening. Da, da, da. And she just starts, and all of a sudden, like the water is open, the floodgates are open.
Yes.
She just starts spewing all this stuff out. And I'm like, well, that hypertonicity that you have
Right.
may be the result of all these other things. So let's kind of take a step back and let's look at the low hanging fruit. What are some of the things that we can change immediately in your
Yes.
life, as much as you can, that can make a difference, right? And in a way that makes her or other patients feel comfortable, in a way that makes them feel empowered and things of that sort. So
No, I love that. Low-hanging fruit, I am all about. I think that was something that being a mom taught
hmm
me because I don't have time. If
hmm
you give me like 1 or 2 things and you show me that there's results from that, I'm yours. But
hmm
like anything more than that, like you don't know my life.
yeah. Oh,
But
I have patients come in all the time and they go, this is all the homework you're going to give me. I'm like, you
I
don't need any more.
know.
You don't have any time.
No. What is that, by the way, where it's something else? Like people are like, "Well, that's it?" And then they
Mhm,
always want kegels, even if you just talked about pelvic floor overactivity. How are
mhm,
we programming women who already don't have enough time to do things that you hand them 2 things and they're looking at you for more and not being
mhm.
like, "Hey, thanks for understanding my life and my existence." What is that? Where does that come from?
Society. I mean, as moms, you're supposed to be super mom. You're supposed to do all the things and then some, and your cup needs to be running over, and you're supposed to be doing all the extra. If not, you're not doing it right. We have to stop pushing that narrative and
Yeah.
start telling people, like, give yourself some grace. I always tell my patients, if you can do this 4 times a week, that is fantastic. Because I never want you to feel like if life starts lifing and you miss a day, it is the end of the world. Because there are bigger fish to fry and
Yeah.
there's all sorts of stuff happening in your life. If you can give me 4 days, I do not care which 4 days they are, we're good.
Exactly, exactly. Just something somewhere. I
Mhm,
don't care what part of the day, like I will sit down with clients and we will spend time being like, all right, let's pick a time to try. What are you going to do right before? What are you going to do right
mhm,
after? How do we need to set that up?
mhm.
And when we do that, it gets done. Or they
Yep.
tell me, you know what, everything that we set up, I was totally wrong. That doesn't work. We need to find something else.
Mhm,
But how many times have you had patients come in and they're like, hey, so this is the exercise or this is what my last therapist gave me to do, and you ask them kind of what it was and they didn't get to it because no one helped them figure out how to kind of put that into
mhm.
their day. It's kind of crazy. But
Yep.
you said something earlier that struck a chord with me. You talked about, people don't come in for, kind of what the problem truly is. And I see this a lot in the context actually of athletes, that they'll come in
Mhm,
and maybe it's prolapse or maybe sometimes it's leakage, but then you ask them about sex and they'll come in for this other stuff, but they won't come in for pain with sex. And you end up,
mhm,
hey, we can do two birds with one stone. But I wanted to talk about this specifically with you is like, how many moms don't come in considering sex as like we talk about sex as an ADL, like an activity of
mhm.
daily living. Well, maybe not daily, postpartum, but
Right.
talk to me about kind of your experience with that and that crossover between kind of what people come in for and then what their needs are for sex.
Yeah, so sex is a biggie. I mean, a lot of my patients, that's their primary concern, whether they know it or not. And I say whether they
Right.
know it or not, because like you said, that's not necessarily what they might have come in for. But ultimately, what's happening is you have people who have always been told sex is supposed to hurt. And
Mm,
so that's what they believe, and they continue going through life. Well, this is just the way it is. Or for them, sex has always hurt. So they don't assume that there's another way or a better way because this is
ah,
always how it has been. So why
right.
would it be any different? Why is there a possibility that it could be any different? And so until they're shown differently, they don't know. And you don't know what you don't know. So
Right.
they're in there thinking, oh, this is just the way it is. Somebody told me it'll just hurt after I have kids. It'll never be the same. And at this point in time, I'm just populating the earth or whatever it is.
Oh,
And it's really disheartening. I had a young lady who came in one time, and this was her situation. And she had seen, OB, postpartum, prenatally, postpartum. They just told her, if you need to relax, whatever, whatever. They actually told her to do Kegels, which was, I'm like, oh God, I'm
I
cringing.
know.
Um, and then she'd seen another provider when she lived in another state, and, nothing changed really. And she comes to me, and she'd seen somebody also immediately postpartum. So she comes to me, she's about 7 months pregnant. Postpartum. And she's totally inflamed, super apprehensive. And I said, listen, there's so much that we can do. I do not need to do an internal check on you. I just want to
Right.
assess the vulva. I can't even do that. I said, but this is something that we can do over time, and we can monitor, and we can look at your progress. But I had already started to suspect that there was something else going on.
Hmm.
I gave her some stuff to do. We started working on relaxation, mitigating stress, all these different things. She came back a month later, and I was able to actually do a proper vulvar assessment. And I sent her to a vulvoderm specialist. She had lichen sclerosis,
Mm,
I told her. And it was interesting because once she got started on medication and she continued with pelvic floor therapy, she came in here crying, and she says, I never knew that I could have sex
right.
that did not hurt.
Oh, it just breaks your heart, doesn't it?
It was, yeah. I mean, like, I'm looking at her going, okay, don't make me cry, because I'm already hormonal.
Right.
And I ugly cry. So I'm like, girlfriend, you do not want to see that. But
Oh,
she was just in tears. And, there was still a lot more to go through, because now we had to work on the relationship dynamic, because she was just straight up avoiding sex. I
yes.
mean, avoiding sex, it was causing havoc on the relationship, and again, some people just assume it's par for the course. This is what it is. This is how it's going to be. The end.
Oh my gosh. So as a mom with both of us have daughters, if you think back to, for this person, what we could have done for her had she had access, had she had information, had her parents known about this stuff to help her as a young girl, like
Mhm.
what do you kind of what runs through your mind when you think about that?
I've been talking to my daughter since she was 5. She's had the pelvis, the pelvic model. She has seen the
Mine
penis
too.
model. Like, we go through stuff. We look at anatomy. We talk about stuff. She has had a period bag, a period pouch in her school bag and her sports bag since she was 7. She's got
Yeah.
wipes, she's got extra underwear, she's got pads in there, because we talk about these things, and I never want her to be afraid. And
Yes.
part of it is, first and foremost, having her know, as my daughter, you can come to me and we can talk about anything. I
Yes.
don't ever want you to be afraid of me. I don't ever want you to feel that you cannot come to me and talk to me about anything. Matter of fact, I would rather you come and you talk to me than go ask somebody else. So if I'm in mom mode, and you feel like, oh no, she's going to be intimidated, or she's not listening to me,
Yeah.
don't call me mommy. Just say, Jay, I need you. And I already
Oh,
know what because my kids obviously don't call me by my name.
right.
They just say mommy. But my mom did that for me. And I
Ah,
remember the first time I told something was wrong, and I was like, June. And she says
she
she was
knew.
talking to someone, and she immediately stopped. And, I grew up in the Caribbean. So if there are any listeners here who are West Indian, African, you get it. We know you call your parents by your first name, and they're ready to take your head off. So the
Yeah.
lady was like, you let your daughter speak to you like that? She says, no, my daughter needs me in this moment, and you are way less important. My mom just walked away.
I'm gonna cry. Oh my gosh.
So I've told that to my daughter, and the baby is coming up. She's going to get the same treatment. So
Yeah.
my daughter knows, if you need me and you don't need me in mommy mode, Jay, I need you, and we'll go sit down and we'll
Yeah.
talk it out, whatever it is.
Yeah. No, that's wonderful. I mean, we've kind of done the same thing. My daughter's 9, and so I've been thinking about getting the period stuff together, whatever, too. But again, just one of the questions that I always ask my patients is like, growing up, what sports did you do? Did
Mhm,
you have any symptoms as a kid? How old were you with tampons? Like, the common questions.
mhm,
Um, but I think just understanding, that there are muscles there and that they're supposed to contract and relax, and putting a tampon in shouldn't be painful. And,
mhm,
having a safe space for those conversations, um, I think it sets us up for a different kind of future looking
Mhm.
into pregnancy and postpartum because you have so much more understanding. I have a client right now with second trimester Ehlers-Danlos and a professional opera singer.
Oh, wow.
So
That's
looking
the
at her
foundation.
pelvic floor is so freaking cool on ultrasound,
That's so cool.
right? And so understanding, hey, we've got some really interesting kind of recruitment strategies and overactivity. So going into labor, we want to make sure that we have time, pain management, things are relaxing. So, all of that. Um, can you take us for a second, like your background and understanding as a pelvic floor PT and what muscles are supposed to do and how that kind of connects with being a doula and kind of how you educate? Because a lot of people don't know what doulas are. I had
Mhm.
one for my first and she was great, but I ended up in a C-section, whole different story. But can you share a little bit about kind of how those two can be connected and carry through?
Oh, absolutely. So doulas are support persons. Doulas are there to educate. They're there to advocate for. I always tell people if you do not see yourself advocating for a client, this work is not for you because by default you have to.
Yeah.
The way our healthcare system is structured, you just have to.
Yep.
We're there for support, whether spiritually. I'm a Christian. I have Christian clients. I have non-Christian clients, but I'm there to support my clients spiritually, however they need me, whether that's prayer, whether it's affirmations, whatever they need. And so, these are all the things that doulas will do. Now, they're not necessarily clinical individuals. Some can
Mhm.
be. And as a pelvic floor therapist and a doula, you get to see the inner workings of how birth and the musculoskeletal could come together. It's like
Yeah.
such a beautiful thing. And so while we're looking at, positioning and, external rotation of the hips opens up the inlet and internal rotation of the hips opens up the outlet, you as a doula are looking at how this baby is positioned.
Mm.
I don't need to do a vaginal check on someone to know where somebody is in labor. I can look
Mhm.
at their body, I can listen to them and what their body is doing because instinctively what you do changes based on the phase that you're in during labor. And
Mm.
so I can look at all those things, with my client and see what's happening. And then when it comes down to the actual pushing part, I tell people all the time the uterus is a smooth muscle. You do not have to do anything. The
Right.
uterus will push, the pelvic floor has to relax. So,
Yep.
what you need to do is you need to be able to relax. We go through pain management. So, I do a lot of breath work early on. We look at what their natural coping mechanisms and strategies are because, I usually go in for the first visit. How do you deal with a headache? And they're like, oh my God, I need the lights
Mm.
off. I can't talk to people. I can't deal with this. I can't deal with that.
That's a good question.
And it's like, okay, well, if you have issues managing pain, understand that this is going to be a continuous amount of pain, just the same way as if you had a migraine or something like that. So we want to be mindful of what our options are at that time. If you want to try a natural approach, that is fine. Here are the things that we're going to have to do. And if you want to try a medicated approach, which there's nothing wrong with that, here's when we would need to utilize that intervention.
Mm.
So it's really helping people to become more bodily aware.
Yes.
And then just kind of helping them to tune in. When you get to the point where you're starting to feel like baby is descended down, oh, wait, I'm feeling this urge. The first thing I tell people to do is relax, relax and let go because you want your body to be able to do what it's supposed to do. At that point in time, your job is to relax and let baby do its job. Let baby and the uterus do their job. Because
Mm.
as the uterus contracts, baby is going to go through all those little cardinal movements, and your job is just to relax. And it's two of you guys working together. If you are tight and tense, that means you're working against baby. Poor little thing's got harder work to do. And that's not what we want. So it's kind of helping mamas to see how them and baby can work together to achieve
Yeah.
that common outcome.
That's I love that kind of just all-encompassing. I wish every mom had kind of just that basic piece of understanding because I feel like most moms, they'll do like a quick class at a hospital or
Mhm,
something, but I don't think it's explained that cleanly, that
mhm,
beautiful thread through of the musculature piece.
mhm.
Because we're all like, even the best of OBs will still, as they're walking out the door, don't forget to do your Kegels, don't forget to do your
Mm-hmm.
strengthening. There's no education on actually the uterus contracts, the pelvic floor relaxes.
Mm-hmm.
Like, how does that get missed?
I don't know. I don't know. And I
Explain
usually
the world.
and I usually joke and tell my mamas, I said, okay, our goal is to make sure your baby comes out with a perfectly round head. You want to know if your pelvic floor is tight? Look at your baby's head after birth.
Oh, the cone head.
The cone head.
The
That
cone
baby
head.
was struggling. So if you want a nice round head, those cute little heads you can put a hat on, then I need you to be able to relax. Okay.
Okay. So that's actually really good information. If you didn't have a doula or somebody like Dr. J the first time around and your kid had a cone head, that might be something to go to PT before
Mm-hmm.
your next pregnancy, with the goal of no cone head. I like that. I
Mm-hmm.
like that. That's a good one. So do you have clients that you will see kind of as a doula and a PT simultaneously?
Mm-hmm.
Or
I
that is
do.
so cool.
I
And
do.
then will you follow them kind of into postpartum as
Mhm.
well?
Yep, I do. So with my doula clients, I see them prenatally. I do an in-home postpartum visit with them, and then we also connect. So I'm following them for 6 weeks anyway. One,
Wow.
because I need to follow them to make sure that there's nothing going on. So I'm touching base with them and or their partner to make sure that there's nothing going on. There's nothing that we need to be concerned about. All of my clients monitor, like once they get into third trimester, they are monitoring their blood pressure. I'm checking in on doctor's appointments to see what's going on. If they have abnormal tests, we're going over all that because I like for them to know knowledge is half the battle. And I think
Yeah.
that a lot of the times, one, because the OBs don't typically have any time.
Right.
So you go in, you take a test, and they're like, "Oh, well, you failed your glucose test." And that's it. They have no context. They have
Right.
no awareness. So now they are freaking out. And
Yep.
they're like, well, what's going on? What does this mean? What do I do? Oh my God, is the baby okay? And now their blood pressure is elevated. And they're like, oh, well,
Right.
now your blood pressure is high. And I usually tell most people here, if you go to the doctor in Metro Atlanta and they tell you your blood pressure is high and it is the afternoon, it is traffic. Traffic is the reason.
I
You
think
don't
DC
need
is
to be
probably the
put,
same.
you don't need to be put on blood pressure medications. What you need to do is be monitored. Okay. Now, if it was like a 170 something over that, then that's different. But you got like a 125, 130 over 80. It's likely because you're driving in this Atlanta traffic. It stresses anybody out. Right. But like little things. So instead of just jumping the gun, let's monitor people. Let's see what's going on. And I want to do a plug for Operation Mist. That was founded by another PT, Dr. Catherine Sylvester. And she's been doing a phenomenal job with that, working with moms in her county where they get monitored. So they use wearables, they use a watch.
Yes.
And they're looking at that information. So all that information is being transmitted to the monitoring station so that if stress levels are high or heart rate's out of whack or blood pressure is out of whack, they know that. And now she has information. They have information that can come in, or she can say, hey, you need to go to the hospital. Like better to
That's
be safe
awesome.
than sorry. And so there are a lot of things out there now that we have access to that can
Yeah.
be so helpful with this. So helpful.
I saw some of that. I think it was like during COVID that instead of for well visits coming in, they would kind of issue monitors and things like that at home.
Mhm.
I hope that stuff doesn't go by the wayside because I think there's so much information that can be gleaned and fear to your point. Like I remember with my oldest, I was working at Georgetown University Hospital and I had to walk from the bottom of the hill to the top of the hill to get to work where the bus dropped us off to the top. And I remember one morning just getting to work and just something fell off. And so I went to the OB and they sent me up to L&D. And I was there for, I don't know, maybe it was like an hour and a half and things sort of settled down, but they wanted a cardiac consult. But it
Mhm.
wasn't going to come for like 5 hours. I'm like, me sitting here freaking out about this is going to make this worse. And
Mhm.
so I signed out AMA. My OB was pissed. Or what it's not AMA, what's it called? Like your
Yeah,
is that
it's
right?
AMA.
Yeah. Okay. I'm like, all
Mhm.
right, I got it right. And I signed out. I was like, no, like I'm not gonna like check me out, let me know I'm fine. Great, no bad stuff. But me being here and worrying about this and nobody's coming, like that's not it's not a good use of the bed. it's a good stressor on me. Like,
Mm-hmm.
can we use basic information like wearables? Yes, I go double. Um, this is for CrossFitters. This is for runners. So I'm a little over obsessed. But like, how can we use easy information to educate moms and then
Mm-hmm.
share that with providers so we can make better decisions? I
I
love
mean,
that.
and everybody has just about now has a Fitbit, an Apple Watch, or something
Yes.
that's connected to their
Yes.
phone. So even simple things like tracking your sleep, being
Mm-hmm.
able to track your heart rate, being able to buy a blood pressure cuff,
Yes.
they have the ones that they have nowadays are getting so much better. And you can even store the information
Yep.
so you can track your blood pressure so that at least when you go to the provider, you have this information
Yeah.
and you can say, listen, when you go in and they're getting a snapshot in time and go, oh, your blood pressure is high, you got this, you got that. And you're like, well, no, my blood pressure was fine yesterday. My blood pressure is fine
Right.
today. Can I monitor it over the next couple of days and maybe then come back in and we can
Yeah.
kind of compare, right?
Yep.
So now you have a lot more information. You feel a lot more confident in that versus the mom who's freaking out going, oh my God, they said my
Right.
blood pressure is high. They haven't given me any more information. Oh my God, something must be wrong. And now their
Right.
blood pressure is really going through the roof because they're panicking.
Well, I think there's two other kind of places that can be incredibly helpful. One, I'm thinking of the woman who is pregnant and she does a sport like CrossFit or something that her
Mhm,
OB is not familiar with. And, she works at a higher level. Like Tia Toomey is a
mhm,
great example of that right now. Like clearly, Tia Toomey, 6-time fittest woman in the world, little bit fitter than I am, just a little. Her capacity in pregnancy is going to be far
way
different
different.
than me, but
Mhm,
you can use that to get baselines. But then also, I love wearables in the context of postpartum. I actually got my Whoop
mhm,
before COVID because I would have days that I just wouldn't feel great. And it's so easy to be like, oh, you just have a couple of kids, or oh, you're just not getting enough sleep, or
mhm.
oh, this or that. You're just a stressed out mom. And I'm like, bullshit, something's off
Something's
here.
wrong.
And
Mhm,
so for me, and then COVID, it was a godsend because I'm like, oh, you feel like shit. Yes, guess what? You should feel like shit
mhm,
today because of sleep. Or if my sleep was fine, then it's time to go back and look at my nutrition and be
mhm.
like, oh, hey, that corner of the grilled cheese, that doesn't count as a meal.
Yes, the grilled
So
cheese is not a vegetable.
it isn't.
I've had to
Man.
come to that reality myself.
That's a shame. That's a shame. No, but I'm a huge fan of wearables. Like I use it a lot with my moms to look at HRV and that kind of stuff. And I'm a huge Whoop fan, just because they do a lot of research. They're putting in stuff on cycles and pregnancy, and they did a lot during
Mhm,
COVID as well. So okay, I feel like we could kind of talk about all the things, but I'm gonna focus down to a couple questions that I have
mhm.
for our guests. First one, favorite activity you have since becoming a mom?
Let's see. I don't know that I've done anything new since becoming a mom. I do enjoy being able to do surprise lunch visits for my kids.
Ooh.
I love having the autonomy of my own schedule that I could, be there at school events. And I get so excited for those things because, like I tell people all the time, preschool and elementary school, they will tell you at the beginning of the week that there's an activity in the middle of the week. And it's always at 10 or 11 o'clock in the morning, like as if people don't have
Right.
anything to do. Always.
Right.
But I love having the ability to be there, and it is so fun. Also, checking my kids out because I tell them all the time nobody's life was ever determined by elementary school. So we're going to play hooky. Let's go.
I
I am that
want you to
mom.
be my mom.
Like,
So
you want to
you
go on a
you
lunch
will
date? Let's go.
you will appreciate this. So at our school, it seems like all of the activities are on my clinic days inevitably. And so we had one come up that's on a non-clinic day, and I got it before the professional PTA moms got it. And I'm like, you don't know, like, it's harder to do that than to get Taylor Swift tickets. Like, it
Mhm.
really truly is. And, I'm fully aware that my daughter is going to be like, hey, mom, for like 14 seconds, but
It
she's
doesn't
going to be
matter.
so freaking happy that I'm there. She'll ignore me the rest of the time. But
Mhm.
like, it's nice to be like, all right, I'll take that 14 seconds.
I mean, I was excited. We had their annual lunch picnic, and of
Oh,
course it rained, but I didn't care, and I was there with them. And my daughter and son don't have lunch at the same time because they're in different
mm,
grades. So I called
right.
my daughter's. I had the front office call my daughter's class so that she can come out for a little bit, and she goes, "Mommy, I'm in the middle of class." And I'm like, "I know." but I want to see you and I need a hug. And she's like, okay, wait, you checking me out? I'm like, no, I'm not checking you out. Go take your butt back to class. And
She's like,
she's like,
I want a hug.
fine.
Are you going to
But
do that
it
when
was,
she's 16?
I mean, if she acts right, I might still do it.
If she's lucky. If she's lucky. All right, this is a good one. One piece of advice for new moms.
Give yourself some grace.
Mm,
Treat every day as a new day because it really is, right? And everything is not always going to be the same. So give yourself some grace. Just take each day as it comes and appreciate the little things because you will blink and they will be in middle school or they will be in high school and you're
yes.
going to be like, what the hell did we do for the last like 15 years? Like, I have no idea.
I think anybody too that had kids during COVID, I don't care what their ages are, there's like a 3-year blur in
Mhm.
there that I just feel like it went exponentially faster. So,
Mhm.
I used to hate that when people told me that, like, treasure the small things, and I'm like, now I'm like, "Oh, damn."
Yeah, my little one is going to be 2 in October and I'm like, but how?
That was fast, like, not
Yeah,
for nothing, like, that was fast. So,
yeah, very much so. And I'm
I'm
like,
I'm sure there were
oh,
nights it didn't feel that way, but
yeah, she's my little party animal. Apparently, she goes down at like 7:30 and then she is a firm believer that it is party time between 10:30 and 12:30.
nice.
But at
Yeah.
least she smiles.
Okay. Okay. My daughter, I always joke, like, since she was a very small baby, I was like, she will be that girl that takes the lampshade to the party so she can dance on the table with a lampshade on her head. And no idea where she got that from. It definitely wasn't me, but
Oh my gosh.
all right. Who is somebody in, it can be like influencer, it can be somebody in the professional space. Like, who is somebody in pregnancy postpartum space that we should know about?
So one person I love is Jenny Joseph. She's in Florida, I believe. She is a huge advocate for Black birthing moms and
Mm,
the midwifery model of care and doing such amazing work in that space. So definitely I would say look her up. Another person that I absolutely love, dear friend of mine, Brianna Battles,
oh,
because
yes.
we love athletes, we train athletes all the time and Brie is phenomenal and she's just a wealth of knowledge, love her to
Yeah.
pieces and just really good at what she does.
Yeah, no, I'm total team Brie as well, and I think both of us are on the pregnancy postpartum athleticism course, and
Yeah.
I love that. I love how collaborative that she is, and I
Mhm.
feel like that's where our field has just grown in leaps and bounds where it's not a pissing match. It's like, hey,
No.
how can we all work together? How can we mash up sexual health and pull in, CrossFit and running and kind of like these things go together because this is what our
Mhm.
lives are like. And I just, yeah, no, that's awesome.
Mhm.
And you too, like a pat on the back for you. You're involved in the it's BIPOC physical therapists
So
group.
there's a Women of Color
Yes.
Pelvic Floor Physical Therapy Directory. Dr.
Mhm,
Janelle Howell on Instagram as the Vagina Rehab Doctor
mhm.
has started this. Love helping her with that. And it's just a beautiful thing because when I started out as a pelvic PT, the only other Black pelvic PT I knew was UC.
Right?
And I thought UC was like the bee's knees. Like I still think
Well,
she's the bee's
she
knees.
is, like,
She
not for
is.
nothing, a Chen
Like
Size who we're talking about, love you, UC.
UC, you are amazing. You are
She's
truly
my
the bee's
girl.
knees.
Yeah,
And but she was the only one that I
right.
knew that I saw. And it was like, there not a lot of us. Like there, what is happening? And so it was really that was another reason why I was like I got to get into this field. Like
Yeah.
there needs to be people out there that look like me to support people that look like me
Yes.
because we all know
Yes.
about the things that are going on in our society. So, but
Yeah.
it's definitely necessary.
No, and thank you for all that work there. I mean, I think PT as a profession, we have a long ways to go.
Mhm.
I think representation in pelvic health, absolutely, but I love seeing more fresh faces, more new grads that are looking to this area of practice, whether it be just, working with women, period, and
Mhm.
having somebody like you as a face to look up to as a mentor, I just think is awesome. So thanks for, I know that you've got time for all this stuff, right? Plus volleyball and
Plus
everything.
volleyball.
Right, exactly, of course. All right. So for you, last question. What does it mean to you to be an active mom in postpartum?
For me personally, it is important for me for my sanity, which is why which
Yes.
is why I still coach volleyball, because like I that's my happy place, right? And then also it sets an example for my kids. Like, and I
Yes.
can't speak for anybody else, but like both of my kids play sport. My older two kids play sports. My daughter is a volleyball player. My son's a soccer player. They've been involved in sports since they could pretty much toddle. And they love it. It's not like we just pushed them in. It was more like, okay, I just need you to run around so you can fall asleep. And then, by that time it was like, mommy, I really want to do this. And I was like, okay, daddy, I really want to do this. And we're like, we'll support you all the way. But, I'm not one of those do as I say, not as I do people.
Mm,
I feel like if I can set the example for my kiddos, then
yeah.
they know what they need to do. The expectation now becomes set, and it's a little bit
Yeah.
easier for them to kind of know, what to do, what to expect, and all those different things. And yeah, so I mean, like yesterday, my daughter had practice and I was upstairs in the gym, like conditioning. And when they came up for conditioning, she's seeing me up there. She's like waving at me as I'm like doing some lunges, going, dear God, do I have to do another one? But like I love it. And keeping up with them, because 3 kids, 2 dogs,
Yeah.
I need energy.
Yes, just to say the least. Yeah. No, I mean, I'm right there with you. I mean, my mom started to be more active, I think, when I was a little bit older, and kind of, they did it to sort of keep up with me with running and things like that. But to be able to provide that example from, earliest ages, I think is such a cool thing to be able to do for your kids and yourself. So yeah, I'm right up there with you. Awesome. Awesome. All right. Well, if you want to know more about Dr. J, and if you're in the Atlanta area, you can check her out on Instagram at the Pelvic Perspective. Thank you so much. I feel like we could talk hours about millions of things and kids and all that good stuff, and puppies and dogs. Thanks so much for being on.
Thank you so much for having me. It's always a pleasure.
Always. Thanks.